Hello, my name is Gabriela Preciado. Today is July 7th, 2021. Course POL 4973, Senior Seminar Punishment and Prosecution. Today I will be presenting the final assignment titled The Pandemic from the Forgotten. This podcast will cover the crisis of the imprisoned in the United States during the pandemic of COVID-19. Throughout this pandemic, we have all adjusted to the new norm and the new rules our government in the United States has implemented in order to control an unknown virus that is still attacking the whole world. However, we become concerned with our lives and health that we ignore our surroundings and other situations. In my own experience, I had seen in the news that many inmates were dying because of COVID-19. There were very little measures to control this virus among inmates and prison guards, so I became interested in researching more in depth on what the issues were for a person that is being incarcerated during this time of pandemic crisis. In this podcast, I will present how the criminal justice system in the United States has taken actions to protect all citizens, but emphasizing in the imprisoned. I also want to present and compare how other countries have conducted measures to protect their prisoners. Furthermore, I will show most likely the neglect that these inmates must endure not only physically but mentally. For the discussion, I will use news outlets, reliable websites, and other reliable sources that can help us analyze several topics relating to this, such as death rates while being imprisoned, the type of measures taken inside facilities, who gets vaccinated, and how many vaccines are being sent to prisons, COVID-19 testing, how this pandemic has affected their sentencing, or how long is their trial being delayed. I am also touching the subject of visitations. I feel that it is important for inmates that are already isolated from the world to also have a sense of communication with friends and relatives from the outside, so we will compare what other countries have done to keep their prisoners sane. Overall, it is important to analyze how governments around the world work to combat COVID-19 inside the penal system. More than half the country in the United States has opened up vaccine eligibility, vastly expanding the ability for most Americans to get the shot, despite their age or any pre-existing medical conditions. But inside prison is a different story. Prisoners not free to seek out vaccines still lack access to them on the whole. Nationwide, fewer than 20% of the state and federal prisoners have been vaccinated, according to the data collected by the Marshall Project and the Associated Press. In some states, prisoners and advocates have resorted to lawsuits to get access, and even when prisoners are eligible, they aren't receiving important education about the vaccine. And it is just not prisoners. Public health experts widely agree that people who live and work in correctional facilities face an increased risk of contracting and dying from the coronavirus. Since the pandemic first reached prisons in March 2020, about 3 in 10 prisoners have tested positive, and 2,500 have died. Prisons are often overcrowded with limited access to health care and protective gear, and populations inside are more likely to have pre-existing medical conditions. In some facilities, basic supplies like soap and toilet paper have been scarce, and mask wearing is inconsistently enforced among both prisoners and guards. Prisoners spend time in communal spaces, and open bar cells do little to contain the spread. Prisoners describe entire dormitories being sick with COVID-19 symptoms. Some prisoners have hesitated to report symptoms out of fear that they will be placed in solitary confinement and not receive proper care. Others report waiting days for medical care, sometimes being turned away or provided only with aspirin. In some states, prisoners and advocates have resorted to lawsuits to speed up the pace of vaccinations. In February, a federal judge ordered Oregon officials to offer the vaccine to all state prisoners, which the state says it has now done. Washington state prisoners filed a similar lawsuit in late March demanding additional protection from correctional staff who refused the vaccine. And last week, a New York Supreme Court justice ruled that the state must vaccinate all people incarcerated in prisons and jails. But vaccine availability is not the only factor corrections officials must grapple with to get the shot in the arm. For example, Carrie Shipp, whose 21 years old son Matthew is incarcerated at Ruben M. Torres unit in Texas, said her son decided not to get the vaccine out of fear and distrust of prison medical staff. Shipp's son encouraged her and her daughter to be vaccinated, but he does not want to receive the vaccine himself. In this website called the Marshall Project, there was a survey of 136 prisoners earlier this year. Many respondents expressed a deep distrust of prison medical system, citing misinformation spread by staff and previous experiences of not receiving care. In some states, vaccine supplies for prisons have been limited by infrastructure and by political demands. Even as more vaccines start to become available to corrections systems, prison officials, public health experts, and prisoners advocates say that there is a widespread hesitancy among prisoners over receiving the vaccine. According to the CDC, 40% of adults in the United States have gotten at least one vaccine shot. And President Joe Biden has promised that all Americans will be eligible for vaccination by May 1st, but vaccination rates behind bars still trail the general population in 2/3 of the state. Among the public information about the COVID-19 vaccine has been publicized by news media, government officials, and healthcare providers, but prisoners seek such information must rely on limited news sources, personal correspondence, and correction staff, who prisoners say are not always willing to answer questions. Prison systems and more than 11 million prisoners worldwide have been disproportionately affected by COVID-19. It is estimated that there are more than 527,000 prisoners who have become infected with the virus in 122 countries, with more than 3,800 fatalities in 47 countries. With limited testing capacity in many jurisdictions and the rapidly evolving situation, the actual number may be much higher. It should also be recognized that due to their close and regular incarceration with prisoners, prison officers, healthcare professionals, and others working in prisons also face an enhanced risk of infection. Undoubtedly, prisons are high-risk environments for COVID-19 for those who live and work there. The impact is heavily felt by prisoners in the majority of countries on all continents. Even relatively well-resourced penal systems face serious challenges in mitigating the impact of the pandemic in prisons. The consequences are particularly severe in prison systems that have been overstretched to start with, including due to systematic neglect, a lack of staffing, and other resources that has led to poor prison conditions, for example, insufficient sanitation, hygiene, and health services. Prison overcrowding, which constitutes to affect a majority of countries worldwide, exponentially increase the challenges posed by COVID-19 and the actual feasibility of introducing meaningful infection prevention and control measures. Already prior to the pandemic, many prison systems struggled to even cater for the basic needs of prisoners and ensure health care, sufficient space, nutrition, and drinking water, access to sanitary items, and decent sanitary facilities, as well as